Yeah, I think there have been a number of really encouraging new findings. We all know that PD-1 blockade is very encouraging, very good and very effective in patients with Hodgkin lymphoma. And there are additional new antibodies being developed targeting PD-1, all of which have been highly successful. So we almost have a plethora of riches, if you like, in that space. But I think that's encouraging because that really allows access to that particular type of therapy across the world. I think, as we mentioned, CAR T cells are now becoming very promising and very encouraging in patients with Hodgkin lymphoma, and there have been a number of trials. So those are additional new findings that I think have really not been reported in enough detail since the last meeting. And then probably thirdly, bispecific antibodies are looking promising, particularly interestingly when combined with a cellular therapy approach. So in other words, preloading bispecific antibodies on cells. And that I think is going to be very encouraging as we look to the future. I think in contrast, there's still challenges. I think much though immune checkpoint blockade is really phenomenal as far as efficacy is concerned, I don't think we clearly understand how it works. So that's why that remains a little challenging to work out how to optimize that therapy when you don't actually know why it's working as well as it is. I think a second challenge is that there are actually a number of pathways that we're now learning are really relevant in Hodgkin lymphoma. So the challenge is how to utilize some of these newer pathways as a way to really augment the already substantial success that we have with other treatments. And then a last point that I think we still have a challenge in, and that is, can we engage the innate immune system? In other words, macrophages. We know that lots of macrophages in the tumor are typically associated with a poor outcome, but can you turn them around and get them to phagocytose the malignant cells? To date, the results with the eat me, don't eat me signal blockers, the CD47 or SIRP alpha antibodies in Hodgkin lymphoma have been quite disappointing. So I think we still have a lot of work to do about how to really get the innate immune system engaged and optimized as part of our treatment strategy.